I think what we often will say is that your zip code may be more important to your health than your genetic code. And what that means is that certain zip codes have either more opportunities, right? Better types of schools, environments, jobs, and then other places don't have as many opportunities. And so we often talk about that as an equity gap, right? There are ways in which where you live is different, and therefore you have different outcomes. I think that a lot of that is through regulation and through history. And so as we think about ways to undo it, we have to be able to acknowledge where people are starting from and then be able to push forward with new solutions to address that equity gap. I think more and more we have talked about healthcare in segments instead of bringing it all together. So for instance, there may be our provider dollars, insurance and other types of things, and we think about that very medicalistically, right? Like prescriptions or medications. We also sometimes will do community benefit or philanthropy, and that's another bucket. And then people may not realize it, but hospitals and health systems are investors. They're just not typically investors in things like housing and community development. What I see is that there have to be ways in which we can invest in housing for health, in long-term mission-related investments using philanthropy and investment dollars, and then also in ways in which we can save money from the healthcare system now in terms of thinking about insurance and other dollars, and that you braid that mission and margin-related investing together. I think these are new approaches. I've just published a viewpoint in the Journal of the American Medical Association calling for hospitals and health systems to do much more mission and margin-related investing as a means to improve health. And I think this will become much more the wave of the future.